the regional office to concentrate on a new deal, a new covenant for health investment. The figures are there for all to see. People pay for health care out of their pockets. In order for 200 million Africans, it means a huge cost element, catastrophic differences which put more than 100 million families in poverty, whereas for 85 million, the high cost of healthcare means they don't have access to it. It's unacceptable, and it is a complete waste. Public expenditure and social security cover an insignificant amount. Only two countries in our region comply with the Abuja commitment, that is 15% of their budget given over to health. This leaves our health system dependent on outside partners for 1/3 of the expenditure. Now, this lack of investment has become chronic and acute because there's been a reduction of 70% in foreign aid. It is highly regrettable, but that's the new state of affairs with disastrous effects for areas such as maternal and healthcare, AIDS, HIV, and the consolidation of our health system. This makes even more fragile our programs relating to UHC. Now, in contrast, and perhaps thanks to the upheavals that have taken place, this is the opportunity to change direction. We need to stop thinking about financing of health as a mere cost element which we try to bear. Health is not just a matter of expenditure, but it is one of investment. Such investment will make it possible to make savings in the long term for development of the continent and its social stability and cohesion. I would therefore suggest that a strategic pact be entered into based on three levers: harnessing of increased national resources, financial innovation, and a rethink of international cooperation. Such initiatives will be coordinated through a WHO regional platform for harnessing resources, and which is transparent and which is open to many donors with a view to make up for the drop in foreign assistance. This new deal, this covenant for health investment in Africa must meet the legitimate aspirations of our people in terms of better access to quality health care. This, therefore, includes primary health care. It's the second pillar which I propose in terms of the work in the regional office. Rethink primary health care. It's the basis for health sovereignty. We can only move forward towards UHC through a revamping of primary healthcare systems in our countries. What we are doing now does not meet the needs of our people, neither in terms of access or quality. You have to make a qualitative jump. Extension and modernization of primary healthcare is necessary. Obviously, it means taking advantage of the present crisis relating to official development system in order to rethink our health system and use a model relating to the superposition of programs, a vertical superposition, and a consolidation of health systems at the basis. Give added value to the value of health systems working hand in hand with high-performance hospital systems, guaranteeing fair access to health from the rural areas. But you also have to think about the urban areas because they are often neglected. It's part of our cultural heritage. A multi-sectoral approach to health issues with policies to promote health, meeting the needs of patients, and anticipates the challenges relating to chronic epidemics with a One Health program, including all the fundamental challenges. I promise to support countries and promote a UHC model which would be sustainable and take inspiration from the successful experiences which have taken place in Africa. Over the last few years, Africa has seen an increase in emergency services. 60% of African people live in conflict areas with a significant impact on health system. 82% of those Africans in a state of chronic lack of health care live in areas of conflict. So you need to have a specific approach to protect the people involved. Hence, the third pillar, building resilient systems and ensure continuous basic health care. That is why I commit myself to working with member states by harnessing the necessary resources to identify vulnerabilities at an early stage and build capacity in terms of human and organizational methods so that we can more rationally use all the tools at our disposal, including the digital tools, etc. Invest in priorities in terms of strengthening health infrastructure and communication and technical units in risk areas in order to strengthen access to health in these areas and also guarantee the safety of healthcare workers. All this can only be done with motivated human resources and well-qualified ones. That's why we will have to invest in human resources as a foundation of the WHO program. We need to make operational the African Consensus on Sustainable Investment in Training and motivating health professionals, particularly in poorer areas, and also come up with relevant programs against the brain drain. Obviously, an investment in human resources, it has to go hand in hand with the African Charter in order to prepare best for the future. Train future health workers will be at the core of WHO Africa program. The region will obviously implement the African Consensus on the need to make more intelligent investments and more sustainable investments in healthcare. Such investment will make up for the lack of investment and in human resources in Africa, as well as the way the African societies which are being modernized see future health workers. If we are to modernize and upgrade health systems, promote health and protect people, all these things require political will and mobilization. So you need a health diplomacy which refocuses health on social and economic development in Africa. And that is my fourth pillar. The Covenant for Investment in Africa must support a concrete action, a visible one on the part of member states in order to improve their resilience and their primary health care. The commitment and support of political actors in the continent is essential. I should note that health has not always benefited from the attention it deserves in terms of the priority choices for the development of our countries. However, the drying up of aid is an opportunity to refocus the international agenda on health priorities. The WHO in Africa must use its legitimate reputation and its power to refocus the discussion on health and development. We have a huge potential which is not used enough in terms of political authorities, development partners, multilateral institutions, and the media. All need to be involved. I commit myself to making this a priority by using to the fullest the political reputation and credit which the WHO has in the region. We shall do this in full consultation and synergy with all the institutions of the African Union, particularly with Africa CDC. My sixth pillar would be a WHO which is skillful and which is better able to listen to its member states. I would like to refocus WHO Africa on its primary vocation, strategic and technical support to member states. The present crisis in terms of financing WHO has created structural and psychological conditions for a radical reform of the action of the regional office. The priority of the regional office will involve technical support, which will be flexible, which will take account of the diversity of our continent. Countries are different, and which meet the specific needs of each country. A more effective harnessing of local, regional, international resources, what I call the Covenant for Investment in Africa, a better synergy between the regional offices and the headquarters with complementary approaches, support which would be more consolidated in order to help countries develop their programs and make them more relevant, geared towards results, including the specific features and the emergency situations in each country. I now turn to Portuguese. I am committed to strengthen the WHO's functions and renew its role and guarantee sensitization, transparency in terms of results, as well as an exemplary system of governance. For that, we need leadership which must come to the fore in Africa, more open to the world. I think that I am up to the task. I have a wide range of relevant experience in terms of leadership as regards the regional directorship. My professional experience includes support to governments in terms of developing health plans and national development health plans, as well as leadership in terms of multinational projects and coordination of a network of countries, including political dialogue for health.
Over the years, I had to manage large international and multicultural teams of experts and to coordinate work with government instances and international agencies. I've done this across multiple countries in all the regions of our continent, in French-speaking countries, Anglophone, as well as Lusophone Africa, and even also beyond our continent, and including 6 years in WHO headquarters. I've experienced the potential of WHO firsthand, but also its limitations. My work brought me to manage large teams of international experts, to mobilize resources and convince and include reluctant and skeptical stakeholders as partners and collaborators. As a result, I can now build on a vast network of technical experts, policymakers, and people with experience and ideas in government, NGOs, and partner agencies. This, I think, will be crucial for building the consensus on an ambitious New Deal to invest in the health of Africa's people. Excellencies, dear colleagues, my experience across Africa has taught me what can be done to move forward. Crucially, however, it has also taught me how it can be done, technically and politically, what the obstacles are, also within the organization, how they can be overcome. It has taught me the value of creating alliances, of innovating and of building an own experience. It has taught me the value of providing visible and tangible results in the field with better access and better care for all. It has taught me the power of Afro-optimism. Ensemble, passons à l'action.
Together, let's act. Excellencies, our generation cannot remain passive. The world is looking at us, our population is looking at us, they want results. I can't promise perfection, but I can promise constant energy, unwavering commitment, and a constant listening ear. We need collective action to ensure that WH Africa is an institution that meets the requirements of it. I would be an experienced, seasoned leader who is forward-facing. Thank you for your trust in me.
Thank you, Dr. Mohammed. We will now continue with the question and answers. I shall now ask the Secretary to take the board, show it to everyone that it is empty, and then pass it around to collect the name tags. Dr. Mohammed, you may either remain at the podium or take a seat at the main table. Algeria.
Thank you, Madam Chair. The candidate, in his presentation, spoke about 6 priority axes with various priorities. I was wondering, if tomorrow he is elected as regional director, which would be the 3 priorities to be set up in the short term as regional director, the 3 priorities?
Est-ce que vous pouvez répéter la dernière?
Could you please repeat the last part of your question? Thank you. In your presentation, you proposed 6 strategic axes with various priorities. If you're elected regional director tomorrow, what would be the top 3 priorities that you would implement in the short term at a regional level? Thank you.
Très bien.
Thank you very much. Excellent question. Thank you, Your Excellency. Indeed, we reflected on this with the member states. I will directly contact the countries so that together we can come up with the main priorities. I will make proposals. One of my proposals would be what I call the New Deal, which is what will we do facing the current crisis that we are going through, that I think is an opportunity. How will we face this challenge? And I have very concrete proposals. Perhaps towards the middle or the end of this year, we could organize a conference on this current crisis. But what is very important is to listen to the member states. We need to listen to them so that we can have a discussion to best understand their needs regarding the WHO, because we have various partners, but we know that the WHO has a very specific position. So the ministers listen to the WHO, the only agency which has the opportunity to meet the ministers of health every week. So I will establish a dialogue with member states. It would also be very important for me to continue the ongoing reform, not only of the regional office, but also of the country offices. I followed closely the structural reform that is ongoing at a regional level. I am also following the one that's happening at an international level. And at a regional level, the ongoing reform should be continued in order to deepen it. Those are the three things. Therefore, reform the structure, listen to the countries to best understand their priorities, and discuss specifically about how we're going to deal with the current financing crisis which we are dealing with at the moment. Thank you.
Mozambique.
Bom dia.
Good morning. One of the serious concerns in Africa are premature pregnancies and the problems of an obstructive nature. What do you intend to do in terms of strategy to handle this?
As fístulas obstétricas.
Fistules, obstetric. They constitute a source of high mortality in Africa. Thank you very much. Mozambique, as a country I lived in for 5 years, thank you. It's a very important point. The obstetric problems in African countries, which they have to face, it's a crucial point, and the statistics are not acceptable. So from my standpoint, we not only need to handle what we see, but we have to go to the very roots of those problems, which refer to maternal health systems. They must be considered as important. Along those lines, a better budget, better investment at the community level, and strengthening of the district health systems, as well as dealing with the specific needs of women and adolescents when they are pregnant. and when they are pregnant, obviously they have to be monitored, prenatal consultations, etc., but also well-equipped services in order to take into account the urgent nature of some obstetric problem. It's an entire whole which needs to be considered, taking into account the role that all the levels of community can play, from primary health care to our hospitals. Thank you very much.
Gabon.
Merci.
Thank you, Madam Chair. Thank you once again, Professor, for your presentation. Regarding prevention, if you were elected, of course, over the past years, in spite of the disengagement of a number of partners, some countries like Gabon weren't able to benefit from some initiatives like Gavi. If you are elected to the position of regional director, what would you do to repair what I believe is an injustice? Thank you.
Hein? Vous êtes? Ah, OK. La prévention, oui, très important.
Prevention, yes, it's very important. My apologies. When we talk about Gavi, I was privileged to be able to coordinate everything that the WHO does worldwide regarding strengthening health systems for 4 years when I was working here at the HQ of the WHO, and I am currently member of the Independent Committee of Gavi. There are around 40 of us. Gavi supports countries for proposals, and it gives a huge amount of financing. We have to be able to deal with this. It should be part of the New Deal that I would like to discuss with countries. What can we do with this withdrawal? Bill Gates said that he will give a lot of money. Okay, we've all seen that. It's not brand new news. We all know about that. But what will we do to make the most of that? What will we do regarding the position of South Africa, which coordinates the G20 currently? What will we do with diplomacy so that health is included in all of the discussions and it is at the center of international aid? How will we be able to deal with that financing gap? Since Gavi is mainly funded by the United States, which has withdrawn from the WHO, we've lost a large part of that funding. As I mentioned in my presentation, the revitalization of the collaboration for health funding should be done with a discussion with the member states. We also need to discuss with Bill Gates and the US. But we also have people like Bill Gates in Africa, so we need to talk to the private sector in Africa to deal with the funding gap that we are so brutally afflicted by at the moment. We need to talk with the member states. So yes, prevention is key. We need to find more funding. The public health institutions exist. For example, the one in Gabon deals with all the aspects such as prevention and preparedness and surveillance of illnesses. We worked together. I think we need to operationalize the New Deal, which I spoke about and which I propose to the organization. I think we should have a special conference on financing health in our continent. Thank you.
Senegal.
Merci beaucoup.
Thank you, Madam Chair. Thank you, Professor, for your presentation. I know you were apply a lot of importance to basic health services. So I would like to ask you, which resources can we use to ensure that the reform is made concrete, especially for basic healthcare in Africa? Thank you.
Merci bien.
Thank you very much, Your Excellency. I was lucky enough to go to Senegal very often. We're closely tied. Community health in Senegal is very committed. In French-speaking countries, we all know what the mutual work has been done, and we are pioneering countries in this. Basic healthcare has been neglected for a number of years, and we need countries to relaunch basic healthcare using the concentration and added value of our communities. We have community values we need to implement. Not only programs set up by partners, because that's often what we tend to see, they're the most visible. We don't necessarily have the time for that, but we need the health ministers and its partners, which are other development partners. Those other developmental sectors, including the Ministry for Finance, Ministry for Decentralization, Ministry for Communities, need to work together to identify true community leaders and benefit from the knowledge of those local leaders. They need to be trained, they need to be capacitated, and also motivated, because what we notice is that they're often motivated by Gavi or the International Fund, but we can train them at a local level or even at a regional level. Maybe the Ministry of Health and its partners can finance their training and their roles so that they can be the first focal point on the ground. We know that culturally, that when we go to a hospital, people also go to different healthcare systems like traditional medicine, and our traditional leaders know the needs, the cultural needs and social needs at a local level, not just in Dakar, for example. You don't necessarily know what happens in the village of Casamas. The people in that village know what happens there on the ground. It is a strength, it is a value that we need to make the most of. We shouldn't let that be funded by partners so that they can create their own program. And I'm saying this because I know what I'm talking about. If you go to a district health service, you will see a Gavi representative or the World Bank representative. What we need to see is that it is under the management of the local district and local leaders. Thank you.
Central African Republic.
Merci, Madame Chair.
Thank you, Madam Chair. Thank you, Dr. Dramé. We appreciate your ideas and priorities. You spoke about radical reforms in the regional office. Give me one aspect. What are you going to change? It doesn't work well, so what are you going to change, and what will be the impact on our countries?
C'est quel pays, excusez-moi?
Sorry, what is your country? I apologize. I am from the Central African Republic. Thank you. I said that you spoke about radical reforms in the regional office. So could you give me an example? What is a weak point in the regional office, and what will you therefore change in order to have a positive impact? I am at ease to answer this question. When I was in Bangui in 2019, I noted one thing. I am speaking in full cognizance of the facts. Self-criticism is important. Very often, you have ready-made solutions for a country. The English speakers say one size fits all. No, you have to be really with your ears to the ground. Listen to the people, and the regional office will continue with the ongoing reform of the organizational chart, but I'll see to it that those colleagues to be chosen will not only be chosen on objective and answerable criteria, but will be based on follow-up, and they will meet specific needs. For example, if you go to the CAR or to Gabon, they are neighboring countries with the same package of activities, that's a mistake. If you go to Senegal and to Cabo Verde with the same approach, is a mistake, in my view. If you go to Seychelles and Madagascar, islands, you have the same approach, it's a mistake. The regional office must listen more to member countries. And when I say listen, I'm talking about active listening, discuss issues with the countries themselves. And the responses to the WHO support meet the specific needs of countries. If you go to Sao Tome, which is a neighbor of Gabon, it's not the same thing. So I repeat, the needs must be specific, and the regional office must be actively listening and must be monitored. I think the efforts are necessary. Unfortunately, not many efforts are made as things stand.
Equatorial Guinea.
Thank you so much, Madam Chair. We'll pose the question to the candidate regarding what specific strategy will he has for small countries and little islands in supporting their health care system. The question is being posed in the context of not always from the regional office has managed properly the demand of those small countries. How this will change under your leadership. Thank you.
Thank you, Sir Minister. I think this is a very important question. As I was just saying, I was even giving some examples. Small countries, since they are small by dimension, for me they are not small. They are just small by dimension. When they are participating in these regional meetings, in global meetings, hardly their voices are heard. I think we should tailor our support to the specificity of country needs. If I gave some examples, I gave Seychelles, Comores, and Madagascar, or Ethiopia, all more or less in the same, etc. If we take Guinea Equatorial and Cameroon and RCA, being neighbors, we go with the same, no, I think we have to listen to them. That's why I will suggest to create a sort of, I wouldn't say parallel working team, but a team colleagues in charge of the small countries, because it's crucial. I've experienced that, to tailor them in order to communicate regularly with these countries, to listen to them, to hear them, and to have written reports. And
Thank you, Dr. Drame. Thank you very much.
So tailored support, that will be with a team, that will be my approach. Thank you.
So This concludes the interviews of all candidates. We will proceed to nominate one candidate by secret ballot at the meeting this afternoon, starting at Professor Chome, I just want to say thank you. The interview is now exhausted, and I want to say thank you for being with us today. I will ask the Secretary to accompany you out of the room.
There is no next candidate.
Nobody.
Yes, so we've done, yeah.
So this concludes the interviews of all the candidates. We'll proceed to nominate one candidate by secret ballot at the meeting this afternoon, starting at 14:30 in this room. We'll resume in a closed meeting with consideration of agenda item number 3 regarding the report on the Committee on Credentials. And immediately after, proceed to the continuation of agenda item 4 for the vote. Only members with 2 lines displayed on the upper left side of their badges will be allowed to enter the room after the break, which is to say no more than 3 persons per delegation. I will now give the floor to the Secretariat if there is any announcement.
Distinguished delegates, la commission de vérification.
The Credentials Committee will meet today during the lunch break at 1:15 for half an hour. The meeting will take place in the garden room on level -1 next to the coffee bar. The 7 member states involved are the following: South Africa, Benin, Gabon, Kenya, Sao Tome and Principe, Senegal, Zambia. Thank you for your attention.
This concludes our meeting. The meeting is now adjourned.
She needs to say which garden room.
Okay, which garden room?
Room X.
Room X.
Room X, exactly. Room X.
Thank you.